Dr. Powers, how would you evaluate a case of a woman that's postmenopausal, hasn't had any hormones since menopause, suffering from joint pain, weight gain, brain fog, and bone loss, she had some bone density and had some bone loss. So how would you assess this patient? How would you evaluate her?
Good question. So essentially, this is a big part of what we do here with our hormone replacement therapy treatment options. And typically we use here either topical bioidentical hormone replacement therapy creams or pellet therapy. And both of those options can address a lot of the symptoms that we're talking about. With those treatments, we use typically both testosterone and estrogen. And speaking to most of the symptoms you talk about, as far as joint pain, weight gain, difficulty in losing weight, brain fog, decreased energy overall, we know that typically women who are treated with testosterone are going to note a real improvement in all of those symptoms. Bone loss is typically addressed really well with estrogen therapy. And we know that really estrogen is the gold standard of treatment for bone loss or osteopenia that people may see on their bone density testing. So when we're seeing women here and we want to start them on anything, offer them those different therapy options, we typically will either do blood testing or saliva testing, which is called ZRT testing. And both of those tests aim to assess hormone levels and also just check overall general health with the blood work that we do to make sure that we're not going to be administering treatment to women that's not most effective or best for them. The ZRT saliva testing we do for the topical creams that we use, because we know that blood testing doesn't really reflect any of the hormone levels that are assessed and adjusted with topical creams. The blood work works very well for assessing hormone levels for pellet therapy. So that's sort of where we get started with all of that.
All right, thank you very much. I really appreciate your time.
My pleasure.